Good afternoon, everyone. I hope you had a good weekend. I want to welcome you to our COVID-19 update for December 7th of 2020. We'll be joined by Dr. Gail Burstein in a few minutes. And of course, we're joined by Kendra Schmidt from Deaf Access Services, who's providing the American Sign Language to those at home. Of course, our media will have an opportunity to ask questions. When we finished our initial presentation, we have a lot to go through. There was a lot that we're working with and dealing above and beyond what we've talked about previously, and you'll see some of it during this presentation. And I would just note that we are once again seeing increases in cases affiliated with Thanksgiving, though thankfully we have not seen the big hospitalization spike yet, even though the hospitalizations are still going up to a degree. We don't expect to receive the vast majority of those hospitalization spikes until sometime later this week, the first ones, though we do expect them to come. So, through December 5th, we have now 29,265 unique COVID-19 cases confirmed in Erie County. The 7-day positivity rate for Erie County is 7.7%. There are unfortunately now 902 people who've died as of December 4th. Our Department of Health epidemiology staff confirmed a few more cases in November, as well as some for the first 4 days of December. And we offer our deepest condolences to the family members of those who've lost a loved one. And I do know from some statistics that there were all likelihood deaths yesterday, as well as on the 5th. So that number will go up once we confirm that those individuals actually did die from a COVID-19 related illness and lived in Erie County. Hospitalizations as of December 5th, there are 470 COVID-19 patients in Western New York hospitals, 95 of them in the ICU. Of the 470 patients in Western New York hospitals, 396 of them were in Erie County hospitals, 76 in the ICU, 55 on an airway assist. One had died in the hospital that day, and 36% of all patients were age 64 and under. We'll go in a little bit more in a moment. We have not had it this year, the Empire State Games, because of the issues associated with COVID, and there were, I know, problems with the budget for it beforehand. But if you were to have the Empire State Games with regards to the regions, we'd be winning some gold medals, but not the ones you want to win. We unfortunately still have, based on new infections, the highest positivity rate for all the regions across New York State at 7.3%, and these are the data that was released by New York State earlier today. The new cases per 100,000, we are unfortunately still leading in that category by having more per 100,000 population for Western New York region. Though we have seen on the severity of infection, we were number one. We actually have dropped. The Finger Lakes is now taken over the lead, so to speak, at 6.04 gross new hospitalizations per 100,000. We're down at 4.21. The hospital capacity for Western New York, this is not Erie County, but Western New York, for the 6th was 28% of beds were available of all the beds in Western New York, and 50% of ICU beds. That's a good thing that the ICU bed numbers are still as high as they are. It's probably the only reason we have not gone into a red is because we still have hospital beds available, including in the ICU beds, though we have seen a reduction in overall hospital availability of rooms in the last week or so. So we don't want to win those Empire State medals. Those are not the medals we want to win. This is the new COVID cases by zip code week ending December 5th. You may think that this is just a repeat of the week before's chart. It is not, but at the top three are exactly the same. The top three towns by zip code for new cases are West Seneca, Hamburg, and Lancaster. They were the week before. They are still the week of. And then it's that 14221 zip code that is in fourth. You see the new daily cases per 100,000 population. This is not good. Actually, Lancaster is leading in that category, which means it's the worst of these cases that you see here, with more than 100 new cases per 100,000 population. West Seneca and Hamburg are pretty high in the 80s, while Amherst, Williamsville, and Clarence are fourth with new cases. They are lower with regards to population per 100,000. Though in fifth place is Cheektowaga, and that had a very high population per 100,000. It is, you see down there, Alden 14004, it has a very high amount per 100,000, but we also believe that some of the individuals in there would be residents of or inmates of the correctional facility that Erie County has in Alden. So the numbers aren't good. They are still increasing with regards to new cases in these areas of concern that we've talked about for the last few weeks. And as I said, last week West Seneca had the highest number of raw new cases. It did again. Hamburg was second after being number one for a number of weeks. Lancaster once again is number third, and their rates per 100,000 population are very high. And that is a big concern because that means that we're still seeing increased spread, new cases on a weekly basis in these regions where we are very concerned of. You see 14215 Buffalo, they had a big number as well, though it's I think it's seventh on there, but its rate per 100,000 is a little lower than some of the others. You don't want to be over 50. You really don't want to be over 25 because that means you pretty much can kill the virus. Between 25 and 50 means it's replicating. Infections are continuing, increasing. Anything above 50 is really bad. And as we talked about before, anything 70, 75 and above is exceptionally bad. And unfortunately, we have too many communities in Erie County that are above 70 in the new daily cases per 100,000 population category. Confirmed Erie County cases by age and gender. This you see, it's a pretty even split. Beforehand, we were seeing some very high numbers in the lower age categories. We still have the 20 to 29-year-old age category having had the most new cases last week, but the 50 to 59 is pretty close, very close actually. So we just want to remind everybody that this is a equal opportunity disease. It can affect you regardless of your age, your gender, your race, your ethnicity, and the size of your bank account. So we want people to understand that it doesn't matter where you live, where you are, your age range, you can catch it. Hospitalizations, we talked a little bit about this. We've seen somewhat of a stabilization on the hospitalizations in Erie County. There actually was a dip a couple days ago, a little bop up in the last day's report. But the total hospitalization numbers, the growth has slowed. It's not as exponential growth as it was at the beginning of last week, though it is still a concern because we do not think we've hit the Thanksgiving hospitalization bump yet. That will be coming, and that will probably drive that number up much higher. Something that is a little concerning is ICU numbers are still increasing, and actually increasing at a little bit more of a rate than they were early on. So we are concerned about that, but as we've noted, our ICU beds are not at the highest they were even earlier this year, and they're still dramatically below as a percentage of overall beds that are being used by COVID-19 patients. You can see it once again in the 2-week chart, the bump that occurred on December 3rd, and then we had a drop and then a slight increase. But one thing we have seen is we've seen an increase in ICU capability, and those are on an airway assist, a ventilator or the like. So we're concerned about that because while it stayed much lower than the overall rate of new hospitalizations, it is still growing, so that is of course a concern. I'm going to turn it over to Dr. Burstein to go into the testing issues for the past few weeks and other issues that we're seeing with regards to the numbers that we're running. So I'll go here, and we'll note that we had the highest positivity 7-day average over the last week, just this past week, though thankfully it has not grown at the rate of that we saw earlier when it was doubling almost on a weekly basis.
Thank you. Thank you. Good afternoon. So these are data looking at the results of all the Erie County diagnostic tests done over the past 6 weeks. And so I just want to point to your attention on the bottom row, the week ending December 5th, which was last week. We've had the most number of cases reported than we've ever had, 4,305 cases, which gives us 7.6% of all the tests done were positive. I can tell you that in our experience at Erie County Health Department with testing, as you know, we're running Binex Now tests on people that are symptomatic. So last week of just testing people who are symptomatic at our rapid testing clinic, 25% of those symptomatic people were positive. So if you have symptoms that could be consistent with COVID-19, it could be a fever, could not include a fever. We see people who are infected who don't have a fever, respiratory symptoms, any type of illness. Please stay home. Don't go to work. Don't go outside your room and infect the rest of your family. Don't send your kids to school. Just please stay at home and get a test if you can. And here this is a slide looking at, unfortunately, the deaths that we've seen in Erie County from due to COVID-19, beginning in March through the way so far this past week of December. And looking at it by age and also the total average of our victims of COVID-19 of age on the bottom row. And so you can see that although we are still compiling the demographic data from the past couple weeks deaths, as of this past Friday, 100 of the 171 COVID-associated deaths that have occurred since November involve people living in congregate living facilities. So that would be nursing homes, assisted living facilities, healthcare facilities, during the time that they could have become exposed and infected. So that just reminds us that our elderly are very, very vulnerable. This is the population that we're seeing. And the last time I looked at the data, although our elderly just comprise, a very small percentage of our Erie County population, about 12 or 13% people 70 and up, they comprise about 80% of our deaths. So we have to be very, very careful at protecting our elderly. So now I'm going to turn it over to the county executive to talk about how we are responding in Erie County.
Thank you, Dr. Burstein. You may have seen last night a report on 60 Minutes of PPE shortage in the United States, and that there is a shortage of nitrile gloves. And I was afraid of this, that we would have a shortage in the United States, as there are many people that are buying. Actually, the U.S. stockpile nitrile gloves in December of 2019 was about 17 million pairs, but it had been reduced to only 2 million by October 2020. Talked about the difficulty in acquiring PPE, not just gloves, but of course masks, gowns, and the like. There is a shortage in the United States, but there's not a shortage in Erie County. We have made a concerted effort over the last number of months to buy in bulk and to buy large amounts because we knew we would need it for not only responding to COVID-19 during the winter, but what would be necessary for vaccine delivery. Erie County's PPE stockpile is full. It's possible we actually have more nitrile gloves in our stockpile right now than the United States' stockpile. And we're going to use a lot of these, and I'll talk to it in a minute as we talk about the vaccine amount. But since COVID-19 outbreak began, we've been stockpiling PPE to use for our own response, to assist first responders and our healthcare heroes, and to prepare for the vaccine delivery to our community. Every time someone gets a vaccine, the individual who's administering the vaccine will put on a new pair of nitrile gloves. They finish that vaccine, they'll take it off, put a new one on. We're going to go through a lot of gloves, we're going to go through a lot of procedural masks, N95 masks. So as of last week, we had over 9 million pairs of nitrile gloves, all sizes, small, medium, large, extra large. We were able to acquire these in very large bulk capabilities, so we reduced the cost, and we're going to be using these over the next number of months. Procedural masks, we have over 10 million procedural masks on hand. N95 masks, all different kinds. The 3M N95 mask is the holy grail. Those are tough to get, but we've been able to get N95 masks, the Macrete version, a different version of 3M, that are very, very good masks, and they have that N95 designation. We have over 2.6 million pairs, or excuse me, 2.6 million N95 masks in our stockpile. Goggles, we have over 117,000. Face shields, over 179,000. Gowns, over 600,000 gowns. And swab testing kits, very important for doing the the tests that we administer with regards to the COVID-19, whether it's the Binax Now test, or that matter, the PCR test, or the rapid ID test, the Avid ID Now test. We have over 327,000 swab testing kits in stock. Now you wonder, why has Erie County got so much of this PPE? Well, it's not going to be just for us. It's going to be for our partners in the local community. We also believe, because of what we've been told, we're going to be assisting not only delivery of vaccine in Erie County, but delivery of vaccine across Western New York. The Erie County Vaccine Task Force has been in place for some time. Our internal team has been preparing for the receipt and delivery of vaccine, and we'll go into a lot more about that over the next few minutes. But I also realize that Erie County should not be the only ones involved with regards to the vaccine delivery. We needed to get some experts from the private sector to help us as well. So I asked an individual in our community to serve as a team leader for our vaccine task force, and he has graciously agreed. Jonathan Dandies, the Vice President of Rich Products and the Board Chair of the Erie County Medical Center Corporation, has joined as team leader to oversee our operations with regards to the Erie County Vaccine Task Force. I'm very pleased to have John on the team. He participated in our first phone call with him as the team leader of our vaccine task force earlier today. And I know John is very chomping at the bit to do this exceptionally important role, which is ensure that we are delivering the vaccine for the greater community as best as we possibly can. Also assisting John and our team is another part of the private sector. Robert Rich III, the president of Roar Logistics, has offered to assist the county with logistics of the operation as needed. I think it's very important that while we are excellent in many of the things that we do, we understand that this is going to be one of the largest logistical operations this community has ever seen. If you think about it, we want to vaccinate every person in Erie County, and for that matter, Western New York. Most of these vaccines are going to require multiple doses, 2 at least. And therefore, we're going to be talking about millions of doses that have to be administered across Western New York, and keeping track of those doses and how the doses are delivered and so on. So I want to thank Jonathan Dandies for agreeing to take on this important role as our team leader of the Erie County Vaccine Task Force, as well as Robert Rich III for offering the logistical experience and expertise that he and his firm have, Roar Logistics, and what is going to be a very, very important task as we move forward. Now, our internal team has done a lot of work so far. They actually have been working with New York State on a plan, a summary of which will be released very soon this week to the public and to members of the media, so media will be able to get an executive summary of our plan. They have already identified locations of extreme cold storage. As I noted earlier, it appears that Erie County is going to be assisting the other counties with regards to the delivery of vaccine, and one of the key factors of that is Erie County has a substantial supply of extreme cold storage locations, not tons of it, but we have enough, we believe, to handle the storage of these vaccines in conjunction with our medical campus and the University of Buffalo, some partners in the private sector, and extreme cold storage freezers that Erie County is acquiring and will have in our own stockpile, so to speak. But many of the other counties in Western New York do not have any capability with regards to these extreme cold storage, except for small amounts that they may have in a hospital in each county. Not enough to, of course, hold what's going to be necessary to offer vaccine delivery in that county. So we are going under the assumption, and conversations I've had with other county leaders indicates, as well as the state, that Erie County is going to be a focal distribution point for much of the vaccine for Western New York, especially with regards to the storage of this vaccine until such time as it can be delivered to the general public or our partners who will be administering it to the general public. The Erie County internal vaccine team, our vaccine task force, has identified points of dispensing clinic locations for mass vaccinations across the county. There will also be smaller clinics in some of the smaller communities to ensure that we're offering vaccinations across the entire county and community. But we've already identified 3 locations that we will be using going forward for mass vaccinations, vaccinations which will be talked about in the future. This is not something that's going to be implemented in the next few weeks, because we do understand that the mass vaccinations of the public is still months away. In the interim, there'll be vaccinations of healthcare, There'll be vaccinations of first responders. There'll be vaccinations of essential workers as determined by New York State, Erie County, and our partners. But the discussions that we're already putting in place are also discussions to help us when the time comes to do mass vaccinations of the general public. We're establishing the protocols that are necessary for clinic dispensing, of which there are many. And we're also preparing messaging to ensure that residents of our entire community receive proper communication, which means we're going to put in place the means necessary to ensure that individuals who do not have English as their primary language get the information they need so that they can be vaccinated, that we'll be dealing with communities of concern, so to speak. So these are the things that our internal team as the Vaccination Task Force have been working on. We advised Mr. Dandies of a lot of this earlier today. He's looking forward to helping lead that team as we move forward with this task force for what truthfully is going to be one of the largest operations that our community has ever seen, the mass vaccination of not only the residents of Erie County, but of Western New York. I'll turn it over to Dr. Burstein to finish up, and then we'll take questions from the media.
Thank you, Mark. So again, Erie County Health Department is offering free diagnostic COVID-19 testing for Erie County residents who have COVID-19 symptoms. And remember, we're seeing in our symptomatic testing clinics, like 1 out of 4 people last week were COVID positive. So if you have symptoms, please stay at home and just go out to get a test. And also we're testing close contacts of confirmed cases. So those individuals should already be in quarantine and just want to get a test to know their status, regardless if they have symptoms. So to schedule, same number, 716-858-2929. Remember, it's by appointment only. And if you make an appointment, please show up because we're a very hot commodity right now, and we fill up very, very quickly. So give up your space to somebody else. Just updates with our partnering with our local schools and school districts of pre-K to 12 with regarding testing using our limited service license. So as you know, the state has released new guidance for testing requirements to keep schools open in the red and the orange zones, and those microclusters, which I think are much more doable for schools to take on. So we're happy that we have been able to help some schools and school districts stay open using our LSL. So far we've actually received 18 memorandums of understanding from the schools. That means that they understand that they have to be in charge and know how to run their own testing program, have their own ordering physician, and that physician is also running their testing program, and they understand how to do the test appropriately and also give the results confidentially and enter the data into the New York State electronic clinical laboratory reporting system so that it is part of our surveillance system. So, and also we're encouraged that more school districts are mulling it over our MOUs and have let us know that they will get back to us shortly. So we hopefully next time we have a press conference, we'll even have more than 18 schools on board with us. So just want to remind everybody, even though it is COVID-19 season, it's also going to be flu season. And so we don't want to have 2 pandemics at the same time, and people don't want to have 2 illnesses at the same time that can cause severe illness and even death. So please get a flu vaccine. We don't have a COVID vaccine yet. And that'll be months away, probably when flu season is wrapping up. So flu season is wrapping up. So please get your vaccine now. It's recommended for pretty much everybody who is 6 months of age and older. You can find it at pharmacies, have a good supply, doctor's offices have a good supply, community clinics are offering it, and you can use the vaccinefinder.org tool to online to find a place near you, or you can just call your local pharmacy or healthcare provider. So I just want to reiterate again what we can do not only to protect ourselves, but also to protect the people around us in our community by keeping our numbers down. We are going up, and we have to keep our numbers down. So please, number one, if you feel sick, please stay at home. You have such a high risk of being COVID positive if you have any type of symptoms, regardless if it's a fever or not. We see a lot of people with COVID-19 who don't have a fever. So please stay at home and only go out to get a test. Please avoid any type of in-person gathering. So if you were planning to go over your BFF's house this evening to watch the Bills game, please watch it with them virtually in the comfort of your own home. This is where we're seeing a lot of spread. It's just people getting together with people that they always get together with. And I'm for it because they've always stayed well with getting together with those people, but the games are different now. The situation is different, and we have no idea who is positive. It could be that friend that you always get together with. So please stay at home. Also, please don't travel to areas that have high COVID-19 rates. I mean, the governor shared with us today on his press conference that there are most of the states outside of New York State even have crazier, higher rates than we do. So please just stay in New York State if you have to travel, and just stay in our community. Please don't pick up other diseases that have been in other counties. Just if you can, just please stay in Western New York. Also, if you do go out for any reason, please wear a face mask. We know that face masks not only protect you, but even more, they protect other people around you if you have an asymptomatic or you're incubating COVID-19. So please wear a face mask in public whenever you go out. And then also keep your distance as much as possible, at least 6 feet from other people around you when you're shopping or doing whatever you have to do, going to the pharmacy. If there are other people, please stay as far apart, at least 6 feet apart. And of course, listen to your mom. Wash your hands with soap and water after any time you touch anything. It's the way we stay healthy, not only from COVID-19, but also through other infections. So we are going to turn it over to our county executive to entertain questions. Thanks.
Thank you, Dr. Burstein. Before we begin, last week I talked about the negotiations that are ongoing with regards to another round of coronavirus assistance for local governments and small businesses, and I do know that those continued through the weekend. Not only was I on a call with the President-elect and the Vice President-elect, I spoke to Senator Schumer, as well as representatives from the National Association of Counties during this weekend on these negotiations. They are ongoing. I was hopeful that they'd have a deal within 48 hours. They do not. It's been like that for a while now, but I was very privileged to be in that call with the President-elect last week, the video call, and I've been invited to participate with the current White House administration, the Trump administration, in a conference call tonight at 5 o'clock in regards to Operation Warp Speed and the vaccine delivery. So I will be participating in that to hear what is the latest from the White House with regards to the delivery of vaccine to our nation. And if there's anything new to report, I'll report that out later tonight. With that, we'll open it up for questions, and we will start with the B News. Ethan Powers.
Hey, Mark. With the governor earlier today defining critical hospital capacity as 90%, and if the most recent numbers you referenced hold true, and that we're looking in the county at essentially 78% of hospital beds being full, and with the potential of a Thanksgiving surge still to come, how confident are you at this point that we can avoid that 12% increase that would put us into a red zone?
Well, we are working with the state and the hospitals on a number of situations, including trying to come up with more subacute facilities to release individuals who do not need to be in the hospital for acute care, but also can't go back into the general population. Often those are individuals who have nursing care. So we are working to try to come up with more subacute facilities. That is something that's ongoing. If we can do that, that will drop the population of hospitals, not a significant amount, but it will help reduce it. So there's a number of things that are going on. We are worried about what's coming in the next week to 10 days. There's no doubt about it. It's been approximately 12 days, 11 days since Thanksgiving. We are already starting to see the new hospitalization cases. We knew that was going to come, the new cases as a result of Thanksgiving. We do expect to see the new hospitalization cases in the next few days. So there is a greater chance of a spike especially considering the amount of individuals who tested positive last week in the older age categories has grown. We know that those people are more susceptible to being hospitalized, but they're not the only ones that are susceptible to being hospitalized. There have been people who've died, unfortunately, under the age of 50 just recently that were in a hospital as a result of COVID. So we're doing our best. We have shared all the data with New York State. I've had more conference calls with New York State than I ever cared to in the last couple of weeks, especially about this issue. But we continue to talk. Thankfully, we've seen a sort of a flattening out, if not complete flattening out, at least a stagnation on the growth, so it wasn't going as rapidly as beforehand. And we will continue to work with our partners in the hospital systems and New York State to ensure that we have enough beds for the individuals that need to be cared in our community. WBEN, Mike Baggerman. Michael, are you there?
Mark?
Yeah, I can hear you. Go ahead.
Okay. Hey, appreciate you taking the question here. I'm just curious to know, last week the governor had announced that there was 170,000 vaccines that are coming to the state on December 15th. I'm just seeing if you are aware of how many vaccines are specifically coming to Erie County and, which nursing homes are going to be getting them.
We were told by New York State that the nursing homes were going to be handled by parties other than Erie County. Vaccines were going to go to the nursing homes from the federal government. Who is going to administer them, we don't know yet. But we were told we would not have a responsibility to vaccinate the patients and staff for nursing facilities. Beyond that, I really can't anything else, Michael. They have not told us how many. And actually, I think the state may be even backtracking a little bit from when they expect the first doses to arrive. So I can't really answer that question as to how much the county will actually receive. We do have sufficient cold storage capability to handle vaccines if they're delivered to Erie County in Western New York for what would be considered the initial dosage. Erie County itself is actually acquiring 2 extreme cold storage trailers, which will be at 2 different locations across the county. Not trailers, freezers, I should say, cold storage freezers. And those will be in addition to the cold storage capability that already exists in our region. So we feel comfortable that we'll be able to handle the storage of the cold storage necessary vaccines, those that need minus 80 degrees centigrade or colder. But I don't know exactly how much we're going to get and when that date will be. We were advised that nursing homes were going to be handled by either the federal government or the state. It would not be the responsibility of the county to vaccinate the residents or the staff of nursing homes. Michael Mroziak, WBFO.
Good afternoon, Mark, and good afternoon, Dr. Burstein. Over the weekend, Mark, you tweeted a video showing progress in the renovation of the former Tycor building, soon to be renamed Lincoln. It'll be a hub for the county's pandemic response. Could you perhaps maybe offer some more details as to what sort of operations will be going in there, and will that also be kind of the hub for Jonathan Dandies and his task force?
This will be the hub for our direct response associated with the epidemiological staff, the contact tracers, and our call center. They're not going to all be on the same floors and stuff like that. They are going to be segregated, so if there was an issue with regards to one, it didn't affect the other. But the Tycor building, as it's known now, and to soon be known as the Lincoln building, named after President Abraham Lincoln, who actually attended a mass there when he was traveling through Buffalo, will be the hub going forward for the Department of Health and its pandemic response. At this point, we do not anticipate needing to have additional space and staff space for the vaccine task force, because the vaccine task force also includes representatives not only from the Department of Health, but the Department of Emergency Services and Homeland Security, the Department of Public Works. We've even brought in the head of our Office of People with Disabilities so that individuals who are disabled, we can provide the vaccine in a setting that's appropriate for individuals who are disabled. We'll be working with our partners in various communities, including the religious community, to ensure that the message gets out, and we are doing things such that everyone understands the need for vaccines. So we'll be relying on our leaders in the faith-based communities to help us out. But I do not anticipate that the vaccine task force per se will have one location where those individuals will be, because truthfully they are spread out across the whole community in our various offices across in Erie County. But I do know, I can tell you from just looking out my office today that the first furniture deliveries are being made for the Lincoln building. And we hope that very soon, by the end of the month, we'll have our first set of operations running there. Our epidemiological staff will be there. Our contact tracers will be there, and our call center. And the thing about it is we've designed it such that it is in a safe manner where there's appropriate space between workstations. So it's not individuals who are all on top of each other. So this has been designed with COVID-19 protocols in mind. And then going forward, it will be the location for many operations for the Department of Health once we finally are through the pandemic, but that's not going to be for quite some time. Sandra Tan, Buffalo News.
Yes, thanks, Mark. Hospitalization capacity is obviously a big factor in whether or not the region moves into a red zone. It looks like our hospitalization numbers dipped a little bit, but I know you expect them to rise again. To what extent do you attribute the decline in hospital numbers to just deaths, as opposed to fewer people getting seriously ill?
Well, I'll answer this and also turn it over to the doctor. I mean, deaths are certainly a part with regards to the opening of beds. We hate to say it, we hate to see it, but it happens. But the one thing I will note is hospitals are doing a better job, a quicker job of being able to get people in and out. They have better therapeutics. They have better ways of dealing with it. Unlike early on, as you see in this chart, where roughly 50% of all people in the hospital ended up in the ICU, and a large majority of those ended up on a ventilator. They're not immediately putting a person on a ventilator. They have appropriate pharmaceuticals to help address this, so giving people a better chance to recover without having to be put on a ventilator. That is a key reason, and I'll turn it over to Dr. Burstein to offer and that's the reason it's been told to me. I'm not a doctor. I have a JD, I'm a doctor of laws, but I'm not a doctor of medicine, as Dr. Burstein reminds me all the time. So I'll turn it over to the doctor of medicine to talk a little bit more about this subject matter.
Thank you. So, Sandy, you do bring up a good point. I mean, we have seen, quite a large number of COVID-related hospital deaths within the past 6 weeks, higher than we've seen in a long time. So, part of what we see with the census are the number of people admitted, the number of people being discharged, and then the number of people who are unfortunately die in the hospital. So it's really a revolving door. And so what I recommend is actually talking to the hospitals and seeing what their experiences are about their hospital census and how that's changing. So thanks.
Thank you. We're getting a little background there, so if you're not speaking, could you just make sure you're on mute? And when you are, it's your opportunity to speak, just hit *6 to unmute yourself. Spectrum News, Erin Ty.
Hi, Mark. I know you were mentioning the funding from Washington and that we're still waiting on that. Is there a plan to distribute any kind of funds that would come out of Congress?
Right now, I don't even know if we're going to get a penny. There's discussions, the latest discussions coming out of the Senate is no assistance for local governments. So that would mean no assistance to the counties, no assistance to the cities, no assistance to the school districts. The House has been pushing for assistance to local governments. I will tell you right now, the primary use of that funding is going to be to pay for the vaccine delivery for our community, because we're going to have huge costs associated with the vaccine delivery. Erie County put $20 million into the 2021 budget of our own cash to help pay for costs associated with COVID-19. We know that cost will be associated with just continuing to do testing clinics and the like, but we're going to have some tremendous expenses with regards to vaccine delivery. And the conversations I had with Senator Schumer, the National Association of Counties, and for that matter, the president-elect, was brought up by NACO, was the importance of additional rounds to help pay for the cost of vaccine delivery for our community. Because while the vaccine is going to be provided for free, we're not going to have to pay for the vaccine. We're going to have to pay for everything else: the cold storage of the vaccine, the delivery of the vaccine, the smaller freezers to ensure that the vaccine doesn't get spoiled after it's taken out of the super cold storage before it's actually delivered. The cost associated with delivering the vaccine in the various communities, whether it's the 3 permanent point of dispensing locations we have, or the ones that move around the county. So we're going to have millions of dollars in costs associated with the vaccine delivery. I'm hopeful that we get money from the federal government. Right now, we have zero coming for 2021. And if money does come, the vast majority of it, I imagine, because I don't anticipate we'd receive as much as we did last round, is going to go towards the direct costs associated with responding to the pandemic and delivering the vaccine. WGRZ, Channel 2, is anyone on?
Yeah, it's Steve Brown. Thank you, County Executive Dr. Burstein. Question back in regards to hospital capacity. Dr. Fauci on the governor's briefing today noted that he didn't think the full effect of the Thanksgiving gatherings would be seen around the country and, of course, here for another week and a half. And he noted that that kind of leads to a potential cascading of contacts because we have Hanukkah coming up shortly, and then Kwanzaa, then Christmas, then New Year's. Minus some serious interventions on people's behaviors, do you foresee a way that we could avoid running into a pause order or a red zone?
I don't know, to tell you the truth, Steve. As I said, we expect to see the first hospitalizations associated with Thanksgiving by the end of this week, but those won't be the only hospitalizations. Those will be the people who've truthfully been the sickest, the soonest. You can get and start showing symptoms 2 days after being infected. Generally, you don't receive it till 5 or 7 days after. Then you start showing symptoms, and then it's usually a week to 10 days after that in which you actually start looking at the hospitalizations. So what Dr. Fauci said is correct. We are going up against a Niagara Falls of potential problems with when you talk about a cascading effect because of the holidays that are approaching in addition to the holiday that we've already had. We are very concerned. I don't have an exact answer as to whether or not that means we're going to go in a red zone and to when. We've seen at least a little moderation with regards to our hospitalizations lately. The growth is not at the same rate it was, but next week we could be talking Monday about a totally different situation where that number that now says 396 for Erie County in hospitalizations could be 496 for all I know. If we have a very bad week of individuals who caught COVID-19 during Thanksgiving finally having to go to the hospital. I don't know if you want anything else, but Dr. Burstein's looking at me, shaking her head, saying, no, I think we got it. We don't know. We are expecting it to get worse. How much? I can't answer that question. And then with the other holidays that are ahead, all I can do is, as I asked last week, was for people to change their behavior. If you're going out and hanging out with your buddies, partying in their garage, thinking it's safer than being in their house, it's not really that much safer. And with the Bills game tonight, stay home. Watch it at home. Don't go out anywhere. If you're a Buffalonian or an Erie County resident and you think, hey, I'm going to go up to Niagara County to the bars because they're open there, or the restaurants for the Bills game, don't. The Niagara County numbers, to my knowledge, most recently were going up, and it wouldn't shock me they're going up because of people coming in from Erie County to Niagara County so that they can partake in fun entertainment, but then putting other people and themselves at risk. So we are very worried. I don't know if this is the calm before the storm. If it is, then it's kind of like the eye of the hurricane because we've already had a storm the last few weeks, and it's not really calm right now. Channel 4, George Rickert.
Hi, Mark. With John Dandies and Robert Rich III ahead of the team, are we safe to assume that the ballpark might be used as one of the 3 mass vaccination locations? And if not, what type of facility are you looking at for those 3 mass vaccination locations?
At this time, the ballpark is not in consideration, primarily because we need indoor capability as well. We're going to be talking about providing vaccines in the dead of winter. So we're not going to be doing this in a drive-through clinic, so to speak, because of the issues associated with the vaccination. So this will not be where you could theoretically drive in and out as if it was the ballpark. So as of right now, the ballpark is not in consideration. Neither, if people want to ask the question, neither is the football stadium. That is not in consideration at this point. Neither is the hockey arena. We have identified 3 permanent locations that the county controls that we think would be appropriate for mass vaccination sites, and then there are going to be temporary locations across the county.
Okay, one quick follow-up. Oh, go ahead.
Let's go ahead if it's a follow-up.
Can you just clarify Erie County's hospitalization rate? You were going through the numbers, and I just want to clarify Erie County's hospitalization rate.
I don't have Erie counties on the screen here. We can get it to you. The rate that was shown here is Western New York's. So this is the Western New York hospital capacity. It was 28%. And when we talk about Western New York, we're talking about Niagara, Erie, Chautauqua, Cattaraugus, and Allegheny counties. Wyoming, Genesee, and Orleans are considered part of the Finger Lakes, even though we know that's not the case. I'll give you a good example. There's a nursing home in Wyoming County that's associated with Wyoming County, the government, that has a relationship with ECMC. So patients from that nursing home generally end up in ECMC. But when it comes to the Western New York definition, under New York State, there was 28% of beds were available on the 6th and 50% of the ICU beds. I don't have the Erie County figures on top of my head, but we could get those to you. We have not actually seen the totals for the 6th yet, which is yesterday. So as soon as we have those, we can release those. Olivia Prue from WKBW.
Hi, Mark. What are your concerns now that some yellow zones have higher positive rates than orange zones?
Well, we're concerned they'll just get moved to the orange. It's not a big surprise. We're seeing growth in these areas. I don't know if the individuals in those communities are just thinking, well, we're not an orange, so we're not that bad. There are still indoor dining and other types of facilities like barbershops, beauticians, gyms in those locations that theoretically could be shut down by going into an orange. And the schools, of course, would have to do a higher level of testing than they are right now. It is a concern. And it is something that we've had conversations with New York, but once again, they're kind of waiting to see what kind of spike there is with regards to cases and hospitalizations based on Thanksgiving. If the numbers continue, I would not be surprised to see all of Erie County in the orange, parts of Niagara County in the orange for that matter. But all I can focus on myself is Erie County. And so we're hopeful that those numbers go down, but if they continue to go up, if the infection rate in those communities continues to go up, would not be shocked to see New York State place it in the orange. Is there anybody else I did not call on before we do one final round of questions? Hearing none. Ethan Powers, B News, do you have any more questions?
Thanks, Mark. I do have one more question. This one for Dr. Burstein in regard to school testing. I've spoken to a few area superintendents who are trying to coordinate reopening plans for their respective districts. And they have mentioned that guidance from the state has been somewhat ambiguous on the specifics of that 20% testing mandate over the course of a month. And I know, Doctor, you just mentioned today that new state guidance for districts was released Friday. Does that guidance include specifics for the new testing mandate? Because it seems like that's what districts are waiting for in order to set a specific opening date.
What type of specifics are you asking about? And the new guidance release was for the orange, testing in the orange and red zones.
Right, just in regard to the way in which, I guess, how many tests have to be completed over a specific week. Does that 20% testing mandate, is there any flexibility within those parameters? It seems like there's some confusion.
Yeah, I mean, those are the state's parameters. So, I mean, the schools would really have to ask the state, and they were given email addresses to ask those type of questions of. So, I would recommend that if they have those questions from the state, they take advantage of that email address. I mean, in our MOU, we lay out exactly what needs to be in place to run a testing program. But however, the parameters of who needs to be tested and how many and under what time frame, that's really all set by the state. So they would have to rely on the state to give them that type of guidance. Thanks.
Okay, thank you.
Mike Baggerman, WBEN.
Hi, Mark. I know you mentioned earlier that the county is looking into creating subacute care facilities. I'm curious if the convention center is being considered as an option for some sort of care facility, such as a field hospital, and if not the convention center, are there any other locations that are being considered as essentially another hospital for people?
I wouldn't put it so much as the county is looking to open. The county is part of the conversations. We have looked at the convention center in the past. Right now, that is probably not the #1 priority for a potential other location. We are looking at, when we talk about subacute, we're talking primarily about a nursing facility or assisted skilled facility. And if you have the convention center, it would be more of a field hospital. That is a field hospital where you'd be putting COVID-19 patients that need additional assistance. The county's not looking at this point, turning the convention center into either. The state is looking at other types of facilities that exist in our community. They range from closed nursing homes, closed hospitals, other types of facilities that could be easily converted, depending on what they have at this point. Because you don't want to just create something out of thin air if you already have the capability from the resource in place. So that's what the state's looking at. And it is I can tell you it's definitely an ongoing conversation, because it's been a conversation that we've had not only with the hospitals and how they could discharge a certain percentage of their populations if they could put them into a subacute facility that otherwise they can't go into right now. So it's going to continue. I don't have an exact answer, but the convention center would not be considered a probable place if we were to do a subacute facility. That was only discussed if we really needed to have a field hospital because of the size and the ability to drive in with ambulances, drive out. So it had features that made it a little bit more appropriate if we were going to do a field hospital than if we were going to do a subacute facility, which is more of a assisted facility like a nursing home.
Just as a clarity on my end, field hospitals then are, when we talk about these massive operations, it's about, the state is the one that organizes the field hospitals, not the county so much?
We are in charge of working with them, but in the end, it would be the state's call. We can't create a hospital on our own. The state would have to approve the location, would have to approve the number of beds, so to speak. They would have to be involved in finding the staff, because it's not like Erie County has a staff of individuals that we would just immediately be able to put in place in a hospital. We don't have a staff to do that at all. So the state would be intimately involved. And truthfully, if it was a field hospital, I believe the federal government would have to be involved with the U.S. Army Corps of Engineers and the National Guard to help to create that field hospital. As it is right now, we don't need that. We've been told that if it had to happen, it could happen very quickly, but right now we're not in that situation where it's moving forward. Michael Mroziak, any more questions?
Yes, one more follow-up question. Earlier today, Governor Cuomo renewed a call to able retired nurses and doctors to come forward and assist those who are on the front lines right now. Have there been any communications or outreach to local retired medical professionals to assist, if not in Erie County, perhaps lend their assistance to other parts of the state where needed?
I know the call has gone out. Erie County is not, as a government, not really leading that because we don't have that many. We do have nursing staff. We don't have many doctors in our staff. We have the Dr. Burstein that you know of.
I'm not retired.
She's not retired. And we have a number of doctors that work in our medical examiner's office, but we don't have that crop of retirees. So it's basically in the hands of the hospitals and the nursing homes to identify individuals that they believe could be helpful. And I do know that there's a lot of folks who retired from hospitals in the last year just because burnout opportunity and fear of risk of themselves catching COVID because of any age or comorbidity issues they may have. So the governor has put the call out. I understand and agree with him. The call needs to be heard and hopefully heeded, but it is not something that Erie County could actually offer much assistance of because we don't have that high amount of staff in those areas that if we talk to our retirees would come flocking back. And remember, there's specialized care we're talking about. Somebody who's a nurse in a school who may have retired recently is not the same as someone who's a nurse on a floor in a hospital that was used to dealing with COVID-like illnesses. So there's only a certain subset of individuals that in some ways I think could be helpful too. when you're talking about replenishing of stock in a hospital. Sandra Tan, any more questions, Sandy?
Yes, thank you. Just two questions, actually. Number one, in regard to the county's new vaccine task force, if you could maybe elaborate, I know you spoke to this a little bit, but elaborate a little bit more about who's going to be part of that task force, what role each of them will have to play in making sure the vaccine gets out to all ends of the community here. And also, in regard to the governor's comments regarding the red zone, this seems like a reprieve of sorts. And I know it might be too early to say, but do you have any sense as to whether or not this new guideline might get us through the holiday shopping season without shutting down businesses? And if you don't know now, do you have a sense as to when you will know?
Regarding the second question, I like statistics, I like data, but you also can use data to try to determine the future, and I'd have to be a magician to try to determine what's going to happen in the future, because the data can only show us what an estimate can be. It's possible that we would reach those red zone numbers based on increased hospitalizations. We showed you data last week, which based on Dr. Winkelstein's models showed that we're going to be having some very high bed count needs. But I really can't answer the question yes or no. It's a hypothetical. We're hoping it doesn't get that high. If it does, we'll have to deal with it. And that's why we're working behind the scenes on those issues. Regarding the task force has in some ways already been in place. They've been working for a number of weeks now, putting together the plans necessary to administer the vaccine, because there's a lot of issues associated with it. The reception of the vaccine, the storage of the vaccine, the distribution of the vaccine, the security of the vaccine, to ensure that vaccine doesn't fall off the back of the truck, as often happened in the past. So I want people to understand that there's a lot that goes into it, and that's why we have representatives from multiple departments in county government. Dr. Burstein, of course, is on this task force, along with Greg Gill, the Deputy Commissioner for Emergency Medical Services from the Department of Health. Dan Neverth is on, the Commissioner of the Department of Homeland Security and Emergency Services, as well as Greg Butcher, the Deputy Commissioner for Homeland Security and Emergency Services. Department of Public Works is on. We have a number of folks that are going to be participating. The task force is not a set in stone group of individuals. There will be subcommittees that are being created to address particular needs, including concerns. That's why we have our Director of the Office of People with Disabilities, Frank Camerata, on, because there's special issues that we need to deal with for individuals who are disabled. We've administered vaccination clinics in the past, but nothing to the same extent and size as this one. So it's going to be an all hands on deck approach. There are individuals right now in county government who are working on tasks who probably aren't even thinking about it yet, but they're in all likelihood going to be provided a task to do with regards to monitoring or ensuring delivery of services, or just being a backstop for services and delivery that we need to do from various departments. There's certain things that we need to ask of our employees who have the requisite skill set to do the work. There's others we will not. But the task force has come together to determine, to address the immediate needs, to put together the plan that's necessary, and then most importantly, to implement that plan. And there's a lot of folks who are going to be involved. It's not set in stone, and that's one of the reasons why I asked John Dandies to join as the team leader, so to speak, of the task force, to get a separate set of eyes from outside county government and somebody who's an expert on operations, to offer advice, to make recommendations to the team. Because when you're in it, as we often know, when you're in it and you're in it up to your eyeballs, you don't always see everything that's going on around you, and it's good to have someone from outside do that. So that's why I'm so happy that John agreed to serve, as well as Bob Rich III, helping us out in a very important aspect of it, logistics, which not only talks about the bringing in of the vaccines, the storage of it, but then the delivery out to locations, especially if we're going to have to be providing storage and potential delivery for the other western New York counties. We're going to need to have a very large operation with people who are experienced in that area. And that's why I would not be surprised as we go forward that we have other people from not only county government, but the community be part of that task force. Aaron Ty, Spectrum News. Any more questions, Aaron?
Yeah, just one more question. So earlier today, Dr. Fauci said that it's likely going to be middle of the summer before a critical mass of people are vaccinated and we can start to see that immunity across the board. How long until we actually recover, though, as a county and just a region from all of the stress that this pandemic has put on us?
I don't know if we can answer that question. The doctor wants to get into the medical aspect of it. She's shaking her head no. I don't know when we would actually say that we've recovered as a region. I'm going under the expectation that we're going to be dealing with this through the vast majority of 2021. And then there's the economic impact as well. That may take years to come out of. I can think of how long it took Erie County to handle and come out of the Great Recession. It took years. So this is not, I can't give you a definitive point from either a medical, the doctor and I think it's going to take some time. And when we're talking about the economy, it's going to take some time. We could be dealing with the aftershock, so to speak, if not the direct aftershocks, at least the effects of it with closed businesses and individuals who are looking for more jobs for a couple of years or more. WGRZ, Steve Brown, are you still there? Are you there, Steve? If not, George Rickert. Any more questions, George?
Yeah. Hello, Mark. Last question. The testing, the surveillance testing that's going on in the schools that are hoping to test their way back into the classroom, will that random surveillance testing in schools be reflected in the overall positivity rate?
Yes.
And if so, do you expect it to bring down the overall positivity rate as more schools do this random testing?
Yes, it will be included in the random positivity rate numbers, and it could bring it down. One thing that we've lost, so to speak, is the random testing that was done at the University of Buffalo and the other state schools like Buff State. And for that matter, SUNY Erie was doing testing as well, so that stopped because they don't have in-campus anymore. So that may have actually helped our rate, make it be lower than what it would have been if we had just tested people who were symptomatic. So we lost that because they've stopped in-person learning, so they don't have to do that testing anymore. And now we've gained the schools, so we've lost thousands from the college-educated level, and now we're gaining thousands on a weekly basis from the school level. So I don't know to what extent if it's going to have that much of an impact as compared to what the colleges that were included previously. But yes, it will be included in the overall statistics, and we'll just have to wait and see if it actually drops the total positivity rate. Final question to Channel 7, Olivia Pro. Any other questions? If not, thank you all. I appreciate you participation from the media. There's a lot that's going on. We got a little bit of free time this weekend, which was good. But there also was a lot of work that had to be done this weekend. Erie County government does not shut down just because it's a Saturday or Sunday. Lots of phone calls, lots of virtual conference calls. Seen a lot of people on a computer lately that I haven't seen in person in quite some time, and it's going to be like that for the foreseeable future. We all need to heed the words of Dr. Fauci. He is the foremost expert on infectious disease control, and I'm very pleased to hear that he will be accepting an administration role with the Biden administration. He'll be taking a high-level role in that. We need to follow the words of Dr. Fauci. We need to follow the words of the doctors. Wear a mask. Try to be as socially distant as possible as we deal with this pandemic. We know that the next few months are not going to be great. We are unfortunately going to have more deaths. As we noted, we're up to 902 deaths in Erie County since the beginning of the pandemic, when the first case hit in March. I was hopeful that we would not have 1,000 deaths in Erie County. It's probable that we'll have 1,000 deaths in Erie County, maybe not by the end of this month. I hope not, but there's a distinct possibility we will at the rate of death we've had recently. Those are 1,000 individuals who various walks of life who now unfortunately are not there for their family members. We know there's a lot of folks who went through Thanksgiving with an empty chair at their table. There's a lot of folks who are going to be going through Hanukkah, Christmas, Kwanzaa with an empty chair at their table because of a loved one who's lost. That's why I ask you to wear your mask to protect yourself, to protect others, so we can keep that death toll down to as low as it can be until we can get to such time as get a vaccinate the whole community, which, as Dr. Fauci noted earlier today, will probably not be until summer when we're going to be able to deliver it for the vast majority of the residents of our country and our community. So until then, let's do our best to get through this and be safe and well all. Once again, thank you, Kendra Schmidt from Deaf Access Services. Kendra and Karen Gambino are the two of the hardest people working in our community, and I want to thank her for all her good work these past few months. And once again, to each of you, be safe and well.